Hello, everyone. Welcome to the Community Rec Magazine Virtual Roundtable, sponsored by Sports Carnival. Today, we're discussing successes and challenges of reopening your facilities after the COVID-19 crisis. I'm Bobby Dyer, the editor of Community Rec Magazine, and I'll be today's moderator. We have a great lineup of panelists for you, with 3 community rec professionals representing different regions of the country, and they're all at facilities that have reopened on different timetables. So we'll be getting a healthy mix of perspectives on how to make reopening work the best you can. So on today's panel, we have Jennifer Harrington, the Assistant Executive Director at the Mittleman Jewish Community Center in Portland, Oregon. We have Matt Hancock, the COO of the YMCA of Greater Tulsa in Tulsa, Oklahoma, and Robin Brothers, the Director of Fort Payne Parks and Recreation in Fort Payne, Alabama. So here's how it works. We'll spend about 30 minutes or so doing a moderated Q&A, and then we'll open up the floor for questions from the audience. Listeners, you can submit your questions as they come up on the GoToWebinar control panel. We'll take time to answer as many questions as we can in the last 30 minutes of the webinar. We likely won't be able to get to everyone's questions, but I'll do my best to get to as many as I can. So now we can get started. Jennifer, we'll go with you first. Can you share your perspective on how your facility's reopening has gone? And this can include just some general information about when you opened your doors, how many members were allowed in, and how many staff members you were using, et cetera, et cetera. And we also want to get your first impressions on how the process has gone so far.
Sure, absolutely. So we just reopened our doors on Friday, June 19th, and we did so with limited hours. So we generally are open about 99 hours per week, and we've done our reopen process with about 68 hours per week. We're generally open 7 days a week. We are closed right now on Saturdays, so we're open 6 days a week. We're having a slow phase 1 opening. That's kind of our process. So we've opened our doors. We are members are scheduling their time slots to come in. So we are allowing 25 members into our fitness center. We have a smaller fitness center. Into our fitness center area, we're allowing 25 members at a time. Right now, our pools, state mandate, we still have our pools closed in Oregon. So both of our pools are closed. Our soccer sportsplex is closed. Our gymnasium, our basketball courts, everything's closed except for our fitness center. So we're allowing fitness center only appointments where members get on, they schedule. We have an entire process for people coming in. They line up out the door 6 feet apart. They come in, they get their temperatures taken, they get the questions asked, they pass that set of things, they go through the doors, they check in, and they are allotted down to the fitness center. They get their 55 minutes down there, and then there's a flow of traffic, and then they exit. So that's gone fairly smoothly. We've seen small numbers, as you would expect, coming back. We've got your diehards that were here 7 a.m. day 1, and then we've got a slow trickle. I would say every day has built up. So we've only been open for a few days thus far. As far as staff members, we have about 10 to 12 staff members in the building that are down running everything, and then we've got some people here in the administrative wing. So we've got a couple different extra people down on fitness, extra people obviously at the welcome desk, at the front entrance, scanning temperatures and whatnot. So it's gone really smoothly. I think the registration process has gone well for members coming in. They're allowed to register 48 hours in advance for their time slot, and yeah, that's kind of what we're at. Additionally, this past Monday, we started our full day camp program. So that's one other program that we've also started. So all in all, things are going smoothly since our launch on the 19th.
Okay. So do you have any idea of when the state is going to allow you to open things like your swimming pool or basketball courts, any of those bigger group areas?
Yeah, we're waiting. So in Oregon, we're on a phased process, as I imagine most of the country is. So the county that the JCC is in Multnomah County, which was the last county in Oregon to get into phase 1. So on July 10th is when we are allowed to be open. When we're allowed to be looked at to go into phase 2. So we will apply for that, and then so as early as July 10th, it's about a 21-day in between phases. So our fingers are crossed that on July 10th we can then unroll and open some other parts of our facility, and we're ready for that, and we'll follow the same guidelines as we have for fitness. So members would make appointments to come in for swimming and whatnot.
Okay. Robin, can you share your perspective on reopening?
Sure. We reopened May 13th. Before we reopened, we sent a membership survey out to all of our members via email and our membership system, just to kind of get their feedback on if they wanted to sign up for times to come into class or come in to use the rec center, if they just wanted to do first come, first serve. And most of them said first come, first serve, and that's what we're trying so far. It's been really successful. We do not screen at the front desk or at the front door. They have to sign in, and when they sign in, at the top of the page is kind of a waiver that says, by signing below, I affirm that I do not have the signs, the symptoms, so on and et cetera. And that gives us a time frame of when they're in the building if something were to happen. It's going really well. Our people have been very receptive of the modifications we've had to make. We have smaller fitness areas. We can only allow 5 at a time in our weight room and 7 in our cardio room. We have a track that goes around the upstairs in our building. It kind of splits those 2 rooms. Most people have been very gracious to, if they meet in the weight room and it's full, they'll walk on the track until somebody exits. We've reached capacity a couple of times. Our group fitness classroom is downstairs. We can have 14 in it. Our more popular classes are doing a Zoom class along with the in-person class. So that's going very well. Locker rooms are still shut down. Water fountains are shut down. Basketball court, pickleball, all that's still shut down. We could reopen basketball, but we're just not ready to do that yet. We know once we open it, even if we try to do 1 person, 1 ball, 1 goal, it's just going to snowball from there. So, and nobody's really complaining. Everybody's very understanding, just happy that we're open and they can come in and work out. We have increased staff just a little bit. We keep at least 2 at our front desk and at least 2 upstairs just to monitor the number of people and continue the cleanliness.
Okay, perfect. And have there been any state restrictions on what sections of your facility? I know you're a Parks and Recreation Department, so you have a lot of ground to cover with your operations. What areas are open and what aren't?
Our golf course is open. Our parks and playgrounds are open. We're going to open one of our outdoor pools on Monday and give that a go. The things that are really shut down by the Department of Public Health orders are things like our locker rooms. We have to run at 50% capacity, no water fountains, no self-serve water stations, no senior programming, things like that, that is by the health department orders. But we are, baseball, athletics just started back competition last weekend in Alabama. That was very interesting. And we'll kind of leave that there unless anybody has specific questions later. But we've been really lucky in Fort Payne. Our community has been very, very supportive of our decisions and know that our decisions are based on, the health department orders, the governor's orders, CDC guidelines, and then their general safety as well.
Excellent. That's great to hear. So Matt, same question for you. Talk about the Tulsa YMCA's reopening.
Yeah, so we were one of the first states to open. We opened as a state on May 1st with a 3-part plan that phase 2 would be May 15th, and we would complete phase 3 there at the end of the month. As a YMCA, the YMCA Greater Tulsa makes up a region of Ys that spans across many cities, which made the process a little complicated. Waiting for one mayor to make a decision while another mayor was going a different direction, and not maybe necessarily the cohesion that you would hope you would have in the metropolitan area. But we opened in phase 1 with general fitness facility use, as well as lap lanes, opened locker rooms, did not open water fountains on May 4th. So we have been operational now for about 7 weeks as it comes to fitness. And then day after Memorial Day, activated our child care, which is called Play and Learn, that parents can drop off when they work out, as well as activated group exercise. And all of those programs are happening through registration, through a registration software that we utilize called Motion Vibe. So Motion Vibe is where all of our reservations are housed at the moment. Our capacity, our state didn't really give us much you can't do. It was the only thing we were restricted on was pool access. and pool access was at 50% of capacity, which was still an inordinate amount of space. So we, as an internal guideline, said we're going to give everybody in phase 1, we were going to give everybody 1,000 square foot of space. So capacity of a 6,000 square foot room was going to be 6 people. You know, and then from there we have reduced that down here in phase 2, where basically group X is still getting a 10 by 10. Most people would say group exercise, you know, 6 foot of distance. Well, we're giving 10 foot of distance in our group exercise spaces. We're also rating capacity for that same 10 by 10 for all of our childcare programs. So we may be licensed by the state to run a summer day camp at 150 kids, but we're only running a summer day camp at maybe 100 kids based on our square footage. We also, like Robin and Jennifer, we're not opening our gyms. Our basketball gyms right now are being utilized for group exercise, and our basketball gyms are being utilized for childcare. We want to make sure that as we went down this road, the YMCA of Greater Tulsa, our volunteers, as well as our local city county health department and our mayor, made it clear that childcare was going to meet immediate need. We've been serving childcare. We didn't really close. We served meals. We did a lot of things like a lot of communities have done. But childcare for emergency first responders was one of the things that we started immediately. So we've been running summer camp out of school time pretty much since about the 3rd week of the pandemic, and providing these first responders and medical professionals the opportunity to have childcare in a safe manner, which I think has really provided us an opportunity to have a safe summer that we've had so far. So we are in week 4 of summer camp here in Tulsa through 3 facilities. 2 facilities that are at max capacity in regards to those capacities that we created. 1 facility that does have some open enrollment. One of the things that we've learned, I think, from WISE across the region, here at least in the central states, Dallas area down through San Antonio and Austin, is a lot of folks are not necessarily seeing the numbers in childcare. There is a need, but maybe people aren't ending up at the Y. It's aunt, uncle, whoever is watching the kids, and there's still a lot of parents at home here in our community. So we were aware and knew that there would be a need in that. So the overall reopening for us, though, frankly, I mean, we were writing the book. There wasn't a lot of webinars that we were blessed to be a part of because we were one of the first states to get the go ahead along with Georgia, so and Florida. I will speak with Robin. As a state that is open, youth sports is an absolute zoo. The YMCA Greater Tulsa is not participating in sports, but given that it is a community rec panel, I will tell you that the states that are open, there are people coming to our state specifically to play a sport that involves a ball. From California, from Ohio, our rec programming around the city is seeing a significant increase in those coming from outside the state of Oklahoma because they can participate in youth sports activities, whether it be through AAU, AABC, whatever the youth sports organization may be. Our YMCA, however, at this point has not activated youth sports, and largely due to the fact that we're utilizing our space primarily for our group exercise, our membership, and our childcare to ensure we can run camp in a safe place.
Okay. Yeah, so you mentioned the youth sports and how that was kind of unexpected, you know, that all these people were flooding to your facility and in your area to play those sports they didn't have available. Were there any other maybe unexpected hiccups or challenges like that that you've had to overcome along the way, Matt?
You know, we as a YMCA, I think it's the opportunity to look at the reservation side of stuff. As a Y, just like a JCC, and as a rec, and from a community rec side of things with Robin, we serve a very broad demographic of people from birth to death. That's our role in rec, is to ensure that we're there for ages and stages. And we knew it was going to be a challenge for those folks, particularly of the older active adult population that would be challenged with a smartphone. They all have them, but our front desk is the one helping them use them before COVID. And right now it's, you know, Matt calls the front desk and says, I need to make a reservation for the pool. And we really want that member to make that reservation for themselves. We want to create some ownership, because if 55 people an hour are calling the front desk and they're wanting to make a reservation when we put a system in place, that's the front desk isn't necessarily getting that time. I think that's a challenge. I think I put this on LinkedIn a couple of weeks ago. The greatest challenge that I have seen personally is we hire people that desire to develop community and develop relationships. And some of our greatest assets are the people that work our member services desks across the nonprofit sector. And those people, when you wear a mask, you don't get that personal touch. You don't get to see the smile that you get to see today on a webinar. That smile's hidden. The relationships that our staff build with families. When people came back, it was odd. It was odd. It's still odd. So how close is too close? So we still want to be the organization that develops relationships, community, and helps people achieve. But we're just having to do it a little different way, and that little different way is unique. It feels different. It felt really different putting stickers on the floor 6 foot away from the front desk and asking people to acknowledge the sticker when the member services staff is typically the one giving out a high five, or typically the one opening the door for that senior member, or wheeling that senior member in from the front door. Our challenge wasn't operational. Our challenge really for us in Tulsa was service driven. We desired so much to serve because that's who we are, and I think that's why we're in the field we're in. For the professionals that are on this call, we're in this field to serve. And at times I found myself consistently reminding our leadership staff to look for ways to serve given the current circumstance, knowing that they're wearing a mask, knowing they're wearing gloves, knowing we're asking people to take some additional steps from a safety standpoint. And that was an initial concern, and I think we've met that. We've found out how to get around those things rather remarkably after being open for 7 weeks.
Excellent. So Jennifer, were there any challenges at the Mittleman JCC that maybe you didn't anticipate and had to overcome?
Yeah, I mean, I think overcoming challenges has been what we've been doing, and I would echo what Matt just said. One of the biggest challenges is figuring out how do we open our doors with the limited capacity and getting as many people in here and serving the community that wants to be served and needs to be served. Few operational challenges, and it's things that you just kind of figure out when you get going. You're starting your group exercise classes, and as Matt has said, we've moved a lot of our classes to our gymnasium. We've even turned some of our racquetball courts into spaces for other usage. And we could do some classes in there with some folks, but you also have to think about the folks who aren't ready to come back, but those people still want classes. So, okay, how do we run a class plus virtually stream classes ongoing? When everybody was at home, we were virtually doing our group exercise classes from home, and that was a great process. Coming into the building and you've moved your areas around, and maybe you could have virtually shot a class from your studio, your group X studio, but now that you've moved everything to the gymnasium, now the lighting's different. Can you get Wi-Fi in there? Can you, so just some of those little challenges that maybe we've moved our space and it's going well for the folks that are coming in. But what are the challenges as far as now virtually running those classes at the same time? So just, something happens, you look at it, you adapt, and then you make it work. So little challenges like that. Another challenge from our day camp program is, we're used to having parents drop off their kiddos and walk them on into the building and say goodbye and those types of things. Well, with limiting contact, we're doing a car line system so doing that whole system of getting kiddos out of the car, excited for camp, checking temperatures in a streamlined process was a challenge at first. But, as teams that work together on a daily basis, we've figured it out and have a great process in place. But I think there's just ongoing they're not huge challenges. They're just small things that you go, okay, and how do we pivot and make it work?
Yeah, definitely. So Robin, what challenges have you faced besides facilities getting flooded in down south?
That was a challenge for us. We had a flood Easter Sunday that damaged our golf course, banquet hall, our complex, and our outdoor pool. So we had to face that challenge. Matt said it very well. We are a service, friendly, smiling, touchy-feely, loving on the seniors group of folks, and we can't do that right now. We hung plexiglass around our front desks, so our staff, if they're behind there by themselves, they may not necessarily have their mask on because they are separated. But it's different, not being able to reach out and touch and our seniors literally and help them. No high fives from the kids. That's been some, personal challenges. One of our challenges was, trying to still reach out and program virtually. Here in Fort Payne, we were just getting started in our actual rec programming when the pandemic hit. That was I've been here 2 years today. It's my work anniversary. But one of my challenges and tasks from our council and mayor was to increase recreational programming. And since I've been here, we were lucky enough to be able to hire a program director. We're getting ready to start the Arthritis Walk with Ease program. We were on go and on ready. And we've had to just put the brakes on and hold everything. And that's hard to keep our enthusiasm. It's hard to keep our staff's enthusiasm up. And then, we were already trying to educate the general public as to what recreational programming really is. And that's been a little harder since we can't do it face to face. But we're up to the challenge. We're going to take care of that. A big challenge for me personally, being a department director, was keeping my staff's spirits up. It's real easy for them to get down when all of our part-time staff had to go home. They were all furloughed and laid off. And then we had to be ready to lay off full-timers. Luckily, we did not have to do that, but we had to reassign some folks to some different areas while we were shut down, and keeping everybody's spirits up when we're just cleaning and trying to plan and not having the people and the energy in the building. That was difficult.
Yeah, I'm sure it was. You mentioned, having to trying to encourage your staff and keeping their spirits up, which is a challenge in and of itself. I think any part of the year, because the industry can be very draining. It's very fulfilling, but draining as well. And so keeping your staff engaged and encouraged is, I would imagine, a constant battle. But in light of these new operational procedures, or what people were calling the new normal, how attuned did your staff become to this new normal? Was there a significant learning curve, or have they kind of caught on pretty quickly to what's been going on?
We kind of caught on pretty quick. We're a staff of 19 full-timers, and we call ourselves #RecFam. Shortly after I got here, I did a staff retreat with them, and I said, okay, what do you guys want to be called? At my old job, we were Team Hard. I don't want to use that. What do y'all want to be called? And they came up with RecFam, and we are truly a family in a small town. And so we've adapted pretty well. We can talk pretty frankly and openly with each other, and that's helped. Took our meeting room during the shutdown and turned it into our staff break room, and pulled our big screen TV in there. And during the lunch hours, we would play reruns of the Parks and Recreation TV show, just to kind of give people a place to go. The room I'm actually in now is kind of our think tank that we've made, that we can come and sit in and have meetings. It's not necessarily in an office environment, and that's helped. But my staff has done really good. They've really pulled together. Even the ones we had to, reassign front desk attendants and recreation leaders, they had to go to the golf course and cut grass, just to help keep things going and moving. And they've all done really well at that.
Great. Jennifer, how about your staff? How have they adapted?
I think everybody's adapted really well. Most of us have been working at home for, 12 to 14 weeks. And as we slowly brought people back into the building before we reopened, we did a full training with all staff that were coming back in. And just training on the new, like you say, the new norms, doing the temperature screen, answering, asking the questions to folks, getting the building set up to reopen was actually a great team building experience. Having as Matt said, putting the stickers on the floor and the arrows and figuring out the one-way flow of traffic. And so I think we were also excited to kind of be back together. And I think as rec professionals and community leaders, like we do adapt. We just know how to adapt to things because we have to. It's a constantly adapting, and even in normal times. And I think across different departments, you know, if you've got a swim instructor who's teaching swim lessons and they have to adapt to kids who maybe don't want to take the lesson. So I think our staffs are all adaptable anyway, for the most part. I do agree with Robin keeping their spirits up, though. It was definitely a roller coaster. So there's got to be a little bit of that cheerleader going and just balancing and being the listener. You know, people are struggling and being mindful of what people were dealing with at home. You know, there were people with full-time jobs that had to still homeschool their kids and keep everything going. So I think all in all, you know, really proud of the team that we have. And I think at the end of the day, everybody adapted quite well.
Yeah, that's great to hear. So Matt, talk about your staff. How have they been doing?
Yeah, you know, one thing that, as I've been part of panels of reopening, because again, there's the joy of being first and that you get asked to do everything. And I've been a part of a few panels. And one thing I've tried to really lift up as part of the panels that I've been a part of is when identifying how the YMCA of Greater Tulsa was going to reopen, we ensured that we had staff of all levels at the table. So we had a member services $8 an hour employee at the same table as myself, our CEO, our HR department, our EDs, and there we had a lifeguard. We had, you know, we had a group of people as we've talked about how do we reopen, because at the end of the day, nothing about the work we do is normal, and it's never going to be normal. Our job evolves every single day, and this is the one area of life that probably never looks like the day before in any community we're in, whether that be a park and rec, or that be a JCC or a Y. It looks different every single day. And so making sure we had buy-in at all levels was important to us. Asking the questions of what training will that take? Will it take training? Is it as simple as sending out an SOP, or is it simple as us shooting a video? Do we need to really, how much time is this group going to need to grasp the concept? We employ about 53 FTEs, as well as anywhere from 550 to 700 part-time employees at any given time of the year. And so how do you get the employee that works 1 hour a week in group exercise the same information that you get the 40-hour-a-week front desk employee? We had to communicate in very, very different terms, in very different ways. It couldn't just be that face-to-face. It did have to include some virtual opportunities, you know, some staff meetings, etc. And I think what Jennifer said was true as well. By including them at every different level, when we spaced equipment, that team was there to help space equipment. When we laid out group exercise, they laid out group exercise with us as a leadership team. And so they saw, I think they saw our leadership team as an association in the decision making with them, and that its decisions didn't come from the top, the decisions actually were met together. And so I think if there was a group of people that was looking for how to get people ready, I think you have to ask the question, what do they need to get ready? Not necessarily just say, here's everything you need, because I don't work the front desk. I can walk past a member services desk and tell you what I think that looks like, but they can tell me exactly what it looks like with that. So asking those staff and getting feedback from frontline staff to develop the plan was really important for us.
Yeah, definitely. So have you been requiring staff to wear masks in all parts of the facility? And that can include like workouts, you know, for your fitness instructors, or I'm sure the front desk workers, if there's not glass in front of them, have been wearing masks. How have you been navigating that discussion? Because that's a big topic right now nationally, whether or not the masks really work and how effective they are, whether or not people should be wearing them.
Yeah, so the evolution of this, when the YMCA of Greater Tulsa started the conversation, we went down the road of, well, do we need to have, we're going to have everybody wear a mask, and we're going to check everyone's temperature, and everyone's going to sign the COVID waiver, and everybody's going to do that. The more and more we found out, again, we were some of the first, and there wasn't a lot of direction. We took the direction at the time, and the direction at the time was not that masks were required, it was masks were recommended. And as we've evolved, I can tell you right now that if you walk into our YMCAs today, throughout the whole pandemic, YMCA of Greater Tulsa staff will wear a mask, they'll wear gloves. We do not have anything separating our members from the employee in regards to anything that's a plexiglass or anything like that. We have specifically went out and put a 6-foot mark on each side of our lifeguard stand. We've put a 6-foot mark at our attendance desks. And we've really set the precedent that we want that conversation to happen in that format, and encourage members as they came in for the first time to remind them of the 6-foot distance we would hope to have. We, as a city, one thing that we were told from our county health department was if a lifeguard was on stand, a lifeguard on stand should not have a mask. And that came from the city county health department, so that's where we followed. The minute that guard gets off the mask or gets off the stand, the guard puts their mask on. But we talked about, so guard has to make a rescue on Jennifer. I can't appropriately give rescue breaths to Jennifer if I have a mask on. So we made sure that we had, from a bag valve side of things, we made sure all of our aquatics areas had supplemental resources that we already had some of, but we made sure we had a larger quantity of bag valve masks, of barriers, etc., to ensure our staff safety was in mind. It's a hot topic in aquatics. NRPA Facebook page, there's an aquatics group that every day the question's asked, do guards wear masks? Do they not wear masks? We followed our city county health department's guidelines and guidance in that respect. Our group exercise instructors wear a mask into the facility, and when they teach a class, they take their mask off. And when the mask is over, they assist in picking up and cleaning alongside our facility staff that are cleaning. They clean their area, and as they do that, they put their mask back on. So as a YMCA Greater Tulsa staff member, PPE is an expectation with the exception of those areas, as well as a camp counselor that may be in an outside environment. If I'm having a conversation with Robin and Robin approaches me as a camper, we've asked our staff to go ahead and put their mask back on. But if I'm outside supervising a group of children playing a game or anything like that, understanding it's 100 degrees in Oklahoma at this time of year, I'm sure Robin can speak to that. Jennifer's maybe a little cooler in Oregon, but we do not want our staff, same thing with gloves. We got so the staff, if they're outside, they're not having to wear gloves. We're providing PPE for all of our staff. Being a level 1 organization, we have access to the back end of some Amazon stuff, and if you're not hooked at the hip with Amazon right now, that's a great place to be. So as a center, if you don't have opportunity to access PPE, we found a great deal of success with stating our case as a child care provider and the need for PPE in our YMCAs to be able to do that safely. So it is a requirement, yes, but there are certain areas of our facility where you would see staff not with a mask on, depending upon the program they lead. As for our members, it's recommended that they mask. However, we had 2 phenomenal visitors come to town this past weekend. One was Al Sharpton and one was the president. And as a part of that, there was a lot of people that came to Tulsa. And I think we are a few days away from a mandatory masking here in Tulsa as a city. That we will have to re-identify how we evolve as a YMCA and how we communicate to our members and what expectations we set forward. But as of right now, we do not have an expectation for our members as a requirement. It is a recommendation.
Yeah, Tulsa has seen a lot of traffic lately.
We have.
So Jennifer, how's the Mittleman J been, handling the whole mask debate?
Yeah, we decided from the get-go that here in our county, it was highly recommended until today. It is a mandate. So we started when we opened on Friday that everybody's required to wear a mask. So that's staff while they're in the building. So it's all staff and it's fitness folks while they're working out as well. We do have plexiglass around all of our main desks and whatnot. Additionally to that, so as of today, the mandate of everybody over the age of 12 wearing a mask has kind of changed our campers. We have some campers in that age group, so we've got some campers wearing masks. We got all our camp staff wearing masks. Again, as Matt said, if you're outside and you're appropriately distanced, that mask can come off. But it's a new thing. Having folks work out with a mask on is definitely a different thing. So I think it'll be interesting now that it's a mandate in our city to see how that impacts people coming in for fitness right now. But right now everybody's wearing it. Some of our group X instructors have, we also have the plastic face shields. So some of those higher cardio output classes, as long as they have that on, they can remove their mask and have that barrier, and then the 10-foot distancing in between also helps. So with that, also moving as many group exercise classes or personal training sessions outside, because we're not in 100+ degree heat right now, has been doable for us as well.
All right, Robin, you're up next. How do you guys handle masks? I know you mentioned that sometimes the front desk workers might not have them on because you have glass at the front desk. How does it work in the rest of the facility?
Right now in Alabama, masks are highly recommended. They are not mandated. So our fitness staff upstairs is the most affected because they're the closest to people and they have to wear their mask when they're within 6 feet of people. We ask that they wear a mask in the building and to the fitness areas, but we don't mandate it. There is rarely a time that there's 2 family groups come in the door at the same time, since we're a small town and small facility. So far, so good. You know, we never know, it could be mandated. We were lucky enough that one of our corporations here in town, the Renfro Corporation, actually switched from making socks to making masks, and they donated the city a lot of masks that are really comfortable to wear. So we do have some comfortable masks to wear. At my complex, the concession staff, even though there's a plexiglass window between them and the customers, they are wearing masks because they're constantly scurrying back and forth around and by each other. So they wear masks and gloves the whole time. I will say this, with a tournament that was held at our facility this previous Friday, I did not see one mask in the attendees. And of course, it's recommended. But you know, that was kind of disappointing to sit there and see all of that. And went by the grocery store and everybody in there had a mask on my way home. So they're recommended right now, but they're not mandatory. Of course, my custodians wear them along with gloves while they're cleaning. We wear them in the hallways when we're passing each other, and then we're trying to stay very, very aware of that 6-foot social distance away from each other. The outside guys, I do not make them wear masks when they're mowing and outside. You know, that's just, they have access to them if they feel the need to wear them.
So we'll get to our first question from the audience now. Matt, we can start with you on this one. So at your facility, are you using a towel service? And if so, what are the regulations for towel services right now?
Yeah, so you asked about one of the few things we're not doing. So we as a YMCA, when we did open, we did get to see what some Ys in Georgia communicated. And one of the big things we wanted to communicate was what you could do in our YMCA. So we did turn off the water fountains. So water fountains weren't accessible till phase 2. So we encourage you to bring a bottle of water. 2 of our facilities have towel service. We did discontinue that towel service during this time. So we communicated that alongside we discontinued the use of our saunas. And really the primary method of communication, and we really didn't receive a whole lot of feedback early on negatively about it, was it all came back to distancing, and it all came back to sanitation. And really used our local city county health department as the guide. In all of our communication that we've put out, we absolutely relayed back to what we're being told, because we're not the professionals in this thing. We are professionals, we are programmers, we're everything, but we are not a doctor. We are not in the business of that. So we have to take the guidance of some of our local leaders, and as much as possible, especially around the towel service, the saunas, and the water fountains initially. Those were the items that we carried from a public health side of things. The Tulsa City County Health Department has guided us to make some decisions, and these are the decisions we've made from that standpoint.
Jennifer, do you guys have towel service? Yeah, how have you been handling that?
We do have towel service in normal circumstances. We do not have our towel service right now. Within phase one, we don't have locker rooms open. So steam rooms, saunas, which is where our locker rooms are located, are closed. And we do not have towel service at this point. I'm not sure we would bring it back in phase two either. We're just encouraging members to bring their own towel for workout purposes and whatnot. So for now, they're closed and just assessing as we go.
Okay. And Robin, you mentioned that you guys also don't have your locker rooms open currently. So how does that affect, if you guys had towel service in the first place, how is that affected now?
We did not have towel service, but when we reopened, we made sure to email all of our members and encourage them to make sure they brought a towel with them to help wipe down the machines, as well as water, because they can't get into water fountains. And yes, our locker rooms, including sauna and steam room, are still shut down.
Okay. Well, I'll stay with you, Robin. So what about, I guess, self-cleanliness tools, hand sanitizer, towels? I've seen in a couple of fitness facilities where there are little racks on the wall that have towels or paper towels and a spray bottle, so you can spray down your own equipment. How have you been handling that? What have you been putting out for members to use, and how have you been communicating to them that these resources are available?
Pre-COVID, our facility staff cleaned the machines at least every hour, most of the time after every use. So a lot of that really didn't change for us because we were already doing that. We leave the Lysol wipes out for our members to use to clean. A lot of our members, even though they know we clean, they're really good to wipe down things before and after they use them. We are trying to be very watchful on that and leave the actual Lysol wipes for our members, and we have made our own wipes for our staff to use to clean, because Lysol wipes are a hot commodity. They're kind of hard to get these days. So I had to laugh, right as COVID was becoming a topic, we had a little meeting and I told my staff, make sure that you are visible and make sure that you're cleaning. And, we had somebody come in and said, this place is always so clean. I always see you guys spraying the Lysol. I appreciate it. Thank you so much. And within 30 minutes, we had somebody come in and say, you guys are spraying entirely too much Lysol. It smells so much like Lysol in here. And we're like, well, we're just trying to be proactive, but our staff was tremendous at keeping the facility clean. That is by far the biggest compliment that they get, is how clean the facility is. So we just kind of had to be a little bit more careful, making sure we were getting all the high touch areas, doorknobs, pins, that kind of thing. So it's going so far so good.
Yeah, definitely. Yeah, tell members like that it's better to smell Lysol than COVID-19.
Yeah,
So.
she was like, I said, we're just trying to be proactive and stay on top of everything with all these viruses around. And she said, what virus? And I'm thinking, watch the news.
Well, that's a whole different problem right there. Yeah. Jennifer, how's the Mittleman JCC handling hand sanitizer and things like that?
Yeah, absolutely. So similar, even pre-COVID, when you have a fitness center, best practice is to be wiping down your machines and whatnot, and training your members to do that, which is what we do here as well. We have our bottles of sanitizer for our sanitizing spray for the machines, as well as the gym wipes that are, mounted to the wall. So that's throughout the facility. Hand sanitizer station is throughout, from the moment you walk in through any point of the building. We've also updated the majority of our locker, all of our restrooms have at least one touch-free faucet now that we've been updating. So all of those things. And then we also, like with anything else, we have, masks available for members if they forget theirs. But it's just continuing to keep up your practice of sanitizing and then take it one step further. We have signs on our cardio equipment to show when it's a sign that says like this has been sanitized. So, our expectation is that if a member uses a piece of machinery, they get off of it, they wipe it down, our staff will go through, sanitize it again, and put that piece of communication on there so that people know.
And Matt, what's the hand sanitizer situation at the Tulsa Y?
Yeah, so I nothing different than Robin and Jennifer said. I mean, our members would tell you that we do take great care in those areas. So we operate when COVID, we started talking about the reopening procedures. We started operating off of a JOT form. It's an hourly JOT form that we expect. It's got, essentially it's got a process for our staff to go through and complete tasks within that facility. We are, one of the biggest things we did right off the bat, once we learned a little bit more about COVID, was making sure that our products were an in-labeled product with the EPA to make sure that what we had would address COVID. And I think that's important for any center that's going to think about opening. Just because you have something that you think is a cleaner, it may not be what it needs to be. So we went in and looked at our cleaning. And so we were using a product at the time called Virex, made by Diversity. And when we looked at Virex had a dwell time that was like 5 to 10 minutes. So it wasn't meant to be sprayed and wiped. It was meant to spray and sit. That's not going to work in a fitness environment. So we adjusted and went to a product that they sell called Oxiver 516 that has a less than a minute dwell time. That is that in-labeled product. That does meet the EPA certification for as a COVID fighter. We also moved into a direction of electrostatically cleaning our facilities ourselves. So we electrostatic cleaning, if people aren't familiar, we have utilized it randomly, but when it came to a reoccurring basis, we're electrostatically cleaning, hitting every one of our facilities on a weekly basis, especially our high areas of childcare. And so electrostatic cleaning, we went out and basically purchased that machine ourselves. And you're looking again at an in-labeled product that's EPA based that at its smallest particle will encapsulate what it touches. And so we are providing all the resources to the members, but I think we've also taken a great deal of pride and taken a great deal of care in showing our members what safety looks like. So when our staff go out and do and treat a building for electrostatically, we're making sure we get pictures of those and using those socially to say the Y is taking extra steps, because they may not be there at 9 a.m. when it's being done, but we want to make sure that they see the benefit of the Y taking some extra steps in Tulsa that maybe some other facilities in our community are not doing, as well as the staff support side of things from the overall cleanliness of our staff coming in behind people. We also in group exercise probably went a little different route. When you show up to class, the classroom is set up. So we buffered our classes almost 30 to 45 minutes apart, whereas traditionally we could run 450 classes and stack them back to back across our association. So if we're running half of our class load, if you walk into a Strength Train Together program that we run through our friends at MOSA, you would walk in and there would already be a set of weights, a step, a mat. And by walking in, you know it's clean because our staff are staying after class. Our staff are utilizing, they're using that Oxiver 516 in like an electric Ryobi, like pesticide sprayer that you'd get at like Home Depot or Lowe's. And so we're laying out the equipment, treating the equipment, letting it hit that dwell time, flipping it, spraying it again, and then we're racking equipment. So our members are actually walking into an environment and walking away from an environment, and there's not a lot of time where they can walk. All of us putting our weights up together. Did Jennifer wipe down the equipment and Robin didn't? We can say without a shadow of a doubt that our staff are taking care of our members and ensuring the protocols are in place versus a lot of areas holding our members accountable for doing so. So we've kind of went outside the norm and looked at like the farming side of things to look for alternative ways to clean our buildings that we maybe haven't done otherwise. That's where hydrostatic comes from, is the ag side of things, and it's also where we found the Ryobi sprayer to be able to run our cleaning chemical through to ensure that we're able to get that dwell time and able to do it at a more rapid rate than somebody sitting there with a sprayer sitting there pumping chemical out of onto a towel or a rag. So
I want to echo what Matt said about the electrostatic sprayer. Other facilities sitting on this call, we're doing the same at the JCC, and that has just saved time and I think has given peace of mind to members for the facilities in the area that are not doing that. That electrostatic sprayer is great. And I had to laugh. We did the same thing. We've got so many campers in this building, and pods of 10 kids using one restroom. And we've got that. They look like a bunch of the counselors are doing like yard work. They have their packs on, and they can go through and spray the areas, the bathrooms in between use, and the classrooms and whatnot. So I would echo that. That's been a great tool for us as well.
Really. Well, Robin, have there been any unique or unexpected cleaning tools you guys have come across or have been really useful since you've opened back up?
Other than being creative and making our own wipes out of paper towels and a cleaning solution, that's all we've really had to face right now. Let's say Jennifer and Matt both have much larger operations than we have going on right now. So, we did use some of the sprayers outside on our playground equipment and that kind of thing, but we are starting to investigate some ionization and some different aspects on cleaning.
Yeah. Well, let's go back to something, Robin, that you talked about earlier, and it's about the lady who didn't like the smell of Lysol or whatever. I'm sure there have been, even though I'm sure mostly the response to these new operational procedures has been positive, I'm sure there have been a few negative responses, for all of you just in random situations. If one of those does come up, and Robin, it sounds like you handled yours pretty well, how do you handle that situation, and how do you instruct your staff to handle those types of situations and educate members?
We had multiple staff meetings before we reopened, and being small, I am able to do the face-to-face with my full-time staff on a daily basis. And most of my part-time staff, they have frequently asked question sheets that should answer any question that they come up with. All of our signage, we have per ADPH, Alabama Department of Public Health, and CDC guidelines. I put that on all of our signage, and that kind of catches some of the questions right there, because they know these are just not random decisions that we've made, that they are mandated to us. And we just try to smile and tell people, hey, it's for your own safety. Yes, I'm sorry you can't go in the locker room and change clothes. We'll be happy to walk in there with you, and you can get your belongings out of your locker. But Alabama Department of Public Health says that we have to keep them closed, and we're doing for your safety. And most people are understanding. We've had a few people that said, can't come in, so I can use a locker room because I come in before work. But then on the other hand, we've had some people come in and pay our daily rate who are actually members at fitness centers in town and didn't feel safe going back there, but felt safe coming to our facility. So we try to keep a smile on our face and positive. Be positive. And sometimes it's like, hey, Mr. Delvin, I need you to come up front and talk to this person because I'm not a positive person right now. So I need you to go take care of this. And we do really well at kind of not passing the buck, but, knowing which situations we need to handle and which ones we don't. We've had a few people, just a few people call and say, why aren't you opening the city pool? Well, do you realize it costs us $50,000 to $60,000 about that? Or, yeah, the governor said we could open pools, but did you realize that to open the pool, this is what we have to do? Oh, I didn't think about that. So most of the time when we just sit down and explain to them some of the ins and outs, they realize, hey, it's not as easy as just going in there and turning the water on. There's a lot of, there's a lot of lead time to some of our activities that we're not being able to do right now.
Yeah, absolutely. Yeah, I'm sure having that conversation is the first step and is very helpful.
Just talking with people, that's very helpful.
Yeah, definitely. Matt, what's your perspective on this about any negative member feedback?
Yeah, I think for a large part early on, the health department guidelines and guidance was absolutely acceptable. Members accepted that. The longer this has gone on, I think what Robin alluded to with the mask is, we came from a time here in downtown Tulsa where when COVID hit, I was still coming to the office. And when I was coming to the office, I, struggled to find a place to eat downtown because everything was closed. And then today I go to eat lunch around the corner, and I could count on one hand the number of masks that I see today. So I think as with that, our community at some time, our community has said, well, the restrictions are enough and we're ready to go. So we have to remind people, I feel like at this moment, and it's a different juncture, that COVID's still real. We're still being provided guidance by the city county health department, and we're using that guidance to make some decisions for the best interest of our community. And that may mean that the sauna stays closed, or that may mean that our gyms, our staff know that our gyms are a priority for our membership through group exercise and a priority for our child care programming. They know that means you're not going to get to go play 3-on-3. They know that means you're not going to get to do it 1-on-1, but they're still going to ask. Responding socially, we've got most of that feedback socially. So making sure we respond socially in a manner that's appropriate. And as a team, when we get ready to go into a phase, we ask those questions. So what could somebody have a problem with? And so when I post a photo of the electrostatic cleaning, and know that somebody's going to ask about the sauna, and know that somebody's going to ask about the basketball courts, and make sure that we have a response that's genuine, because that's who we are. That's who Robin and Jennifer are as organizations as well. Make sure we show up as a genuine organization, that we're not making this decision to make your life hard. We're making this decision based on best practice, and best practice at the time is guidance from our city county health department, as well as what is best and at the highest need for our mission at the time. And that's typically been childcare, overall membership, or health and wellness for our YMCA.
Definitely. And Jennifer, what's your take on member feedback?
Yeah, I mean, really echoing what Matt just said, we're just unfolding here. So I think people are just so happy to get out of their houses and have a place to come, that they're willing to do whatever they need to get in the building. But I think, we're in the business of, we keep saying it, we're in the business of community and just personal interactions with people. And I think any complaint or question or pushback that we would get on anything, we would respond to it in the way that we do on anything. I mean, that's just normal when you're working with the public within these organizations. You constantly have questions that come up, and the positives and the negatives. So I think leaning on the mandates from the state and the CDC is what we'll do going forward. But right now we've just got happy people. We're happy that they have somewhere else other to go than their own homes. So
yeah, definitely. And I know they're all happy to be back, and it's good to have all the facilities reopened. But that is actually all the time we have for today to talk about reopenings. I hope we were able to give everyone here some actionable insights and some good tools to adapt for the future of the industry, whatever that might look like. I also want to thank Sports Carnival for sponsoring today's roundtable, and I especially want to thank each of our panelists here for their time and their perspective. It's a true pleasure to get to speak with all three of you and get to hear your insights on the industry. So I hope you guys have a great week. I hope everyone listening and tuning in has a great rest of their week, and we will see you next time. Thanks.